Phaco in miotic pupils or 4 to 5 mm dilated is always challenging, and mechanical pupillary dilating techniques like sphincterotomy, pupilloplasty and Hyrix hooks are needed. These techniques, though effective, distort the pupil, resulting in troublesome glare and halos. The introduction of pupil expanding rings has made life easier both for the surgeon and the patient. The ring is made of 5,0 polyamide monofilament with 4 circular curls placed at equidistance to each other. This is easily loaded under HPMC in an IOL cartridge and loaded onto an IOL plunger, which can be injected through a 2.2 or a 2.8 mm incision. Here we discuss the management of a complicated cataract with shallow anterior chamber, miotic pupil and floppy iris with the use of pupil expanding rings. Phaco in miotic pupils starts with proper placement of the main and the side port incision, as this would maintain the anterior chamber effectively and help with the intraoperative maneuvers during the surgery. The pupil expanding device is then injected into the anterior chamber, and with the help of a simple Sinskey hook, the curls are used to engage the iris margin as shown here. The curls on the ring are so widely placed that it is very easy to engage the iris, and the ring rotates as you tuck the iris into each curl successively. By this technique, you can easily engage the iris onto the ring with the help of a simple Sinskey hook and from a single side port incision, and the need for switching hands does not arise here. The ring makes a square-shaped pupil which measures around 6.25 mm diagonally. The dry soft shell technique is a modification of the soft shell technique, which consists of a dispersive viscoelastic coating the endothelium, followed by a coercive viscoelastic in the center and a lake of BSS touching the nucleus. The rhexis is performed in this lake of BSS. The rhexis is done very close to the ring, which ensures that the rhexis is as large as possible. Hydrodissection is then done in the right plane at multiple quadrants, and this ensures that the nucleus is made freely mobile inside the capsular bag. Phaco parameters are set at low vacuum and flow rate with the phaco power used, which is directly proportional to the density of the nucleus. The size of the phaco needle is directly proportional to the density of the nucleus. A larger phaco needle tip for a denser nucleus would reduce the phaco energy and the time needed to emulsify a dense nucleus. The phaco technique of choice depends on the nuclear density and the surgeon's preference. Vertical chop or the stop and chop technique are the preferred technique in a miotic pupil with a denser cataract. Here I perform the stop and chop technique, and each quadrant is then grasped at the apex, brought to the center of the pupil and emulsified in the pupillary plane. A coercive viscoelastic device helps to maintain the anterior chamber during the surgical procedure. A proper hydrodissection would enable you to perform a cortical aspiration with ease with a phaco hand probe as demonstrated here. The refractive extended depth of focus IOL is the latest generation presbyopia correcting IOL, which has a near vision add of 3.3 diopters, is inserted directly into the bag. Under a coercive viscoelastic, the ring is then removed easily with the help of a Sinskey hook by disengaging each curl from the iris margin. Once all the curls are disengaged from the iris, the ring is removed from the anterior chamber using a cyclodialysis spatula and a Sinskey hook through the main port incision. An opposite clear corneal incision is done nasally, as the patient had a 0.8 diopters of cylinder. The IOL is centered in the capsular bag by ensuring that the central ring of the IOL coincides with the visual axis of the patient. This is done by superimposing Purkinje images 1 and 4 as shown here. This reduces the postoperative glare and halos in the patient. This image shows a round pupil on postoperative day 3. Currently, the most popular pupil expansion rings is the Maligan ring. It is a square-shaped foldable device made of polypropylene. The one-piece planar device features 4 circular curls located at equidistance on the ring. The device is injected and removed from the eye with an injector system. The ring has 8 iris retracting points, creating a rounded pupillary opening. It comes in 2 sizes of 6.25 and 7 mm. The 7 mm ring is useful in floppy iris syndrome. The Maligan ring can also be used to stabilize the rexus margin in case of zonular weakness during phacoemulsification. The Bhattacharjee pupil expansion ring is made up of 5O black monofilament polyamide. It is available in square and hexagon shaped in various sizes of 6, 6.5 and 7 mm. It is a planar structure with inward facing notches located at the corners. These notches are used to fixate the pupillary margin. Planar structures makes the ring extremely thin, making it possible to inject through a 0.9 mm incision. The rings are difficult to place under the iris with the Sinskey hook and hence need a special fixation forceps to securely engage the iris. The beta hex can be easily removed through a 0.9 mm incision with help of a Sinskey hook or any other special forceps. Mechanical pupillary dilatation is very helpful in achieving dilatation when topical medications and intracapsular mydriatics fails. Pupillary expansion rings significantly reduces the chances of complication and increases success rate in small pupil cataract surgery.